Hello, I'm Dr. Dennis McKenna, joined again by Dr. Fred Venditti, our hospital system general director. Today is Thursday, October 1st, giving you the update from Albany Medical Center. Okay, first graph, Capital Region, 8 counties, currently 16 in the hospital being treated for COVID-19, and you can see what that looks like there in the graph. Of those 16, let's look on the second graph, there are 7 being treated at the medical center. And Fred, what we learned today is that there's another person on a ventilator here.
Yes, that's right, Dennis. First one in a long time.
So it is a good reminder that, COVID is still in the community, and if you're one of those populations that may be vulnerable or can get it, you can be sick. So we have to keep our guard up, as you said.
We absolutely do, Dennis. And around the country, there are lots of areas where COVID is rising in terms of its incidence.
Okay, let's move on to non-COVID topics, and we'll say this. It all begins with patient access. Patient Access Week, we want to call out our incredible frontline healthcare professionals, 150 here who do patient access.
First face you see when you walk into the emergency room or lots of other sites here in the hospital.
And they do a lot of things, and I certainly don't want to minimize it by forgetting certain things, but they do registration and scheduling. They take care of all sorts of ways in which people get in and out of the hospital, and they truly are great professionals.
Yes, they absolutely are.
We want to thank them.
Shout out to them.
For sure, and their leadership team, Kathy Palazzi and Brenda Pascarella. Okay. Bernard and Billy Duker Children's Hospital Radiothon is going on today. Fred, I know you were down there today.
Yes, I was.
Yes, answering phones.
They were really having a good time down there,
Yep.
And it's been tremendous, actually. I think we're doing quite well, maybe even a little bit ahead of last year.
So let's talk about this. 810 AM and 99.5 The River, 2 radio stations, 2 great radio stations, part of the iHeart Radio network, and their on-air talent today was helping us raise money. I think we heard a number today. Since 1998, they've raised a lot of money.
$5 million,
$5 million.
Dennis. 22 years, $5 million. Just incredible support of the community.
Yeah.
Very, very important to our mission as a children's hospital.
Absolutely, and let's talk about that. So we had about 100 members of our workforce who volunteered either today or coming in tomorrow to answer phones. We thank them very much. And let's talk about the programs that it supports. This children's hospital has a significant number of providers that are unique in this region, in fact, within the 25 counties.
That's right.
Yeah.
So, Dennis, we have over 140 physicians who specialize in pediatric care, all kinds of different things, surgical and medical care, emergency care. We have 40 different specialties that are covered by those physicians. We have over 400 nurses who provide care within the children's hospital.
And those wraparound services also include child life specialists and pharmacists and others who provide care to children specifically, which is wonderful.
And some of that is really important. Think about a young child being in the hospital, that child life specialist helping them get through that very disturbing potentially event in their lives. And that's where this money goes. This money goes to support those kinds of wraparound services that aren't covered by insurance, aren't paid for in any other way.
Right. So again, thank you to the community for their generosity, and thank you to our workforce as well. Now, many of those children that we care for come in the form of transfers into the medical center. We heard this morning that yesterday we took and transferred 65 patients. Let's put that in context. What is a transfer to the hospital? A transfer means that patient began their day at another hospital. They got into an accident, they may have had some chest pain, they may have been sick, they show up at another hospital. We know the hospitals in this region are great hospitals.
They are.
But they often don't have either the providers or the resources or the technology to care for them. So they get sent here. So 65 came here yesterday, which is an amazing number.
It's a record for us yet again. And you know, Dennis, in the last 2 weeks, we've had 2 days with more than 60 transfers. So it's just a tremendous service that we provide to the community here in the Capital District.
Last year we had about 15,600 transfers in, and obviously we'll probably continue to see those numbers go up.
And they come from all over, Dennis. You know, Plattsburgh. We've had transfers from Watertown. Vermont, Massachusetts, even parts of Connecticut transfer patients to us.
Okay, Workday. We talked about this earlier in the week, and Workday went live. A lot of work behind the scenes. We had mentioned a couple specific sponsors of that, leaders in the hospital who help with that. I forgot to mention Michelle Cakeley. So Michelle, we appreciate you very much in the work you did.
Thank you, Michelle.
How are we doing with Workday?
Dennis, I think we're doing well. The service center is answering calls very quickly. 68% of calls are being answered in less than a minute. And
Incredible.
Actually, less than 30 seconds. There are 21 tickets that have been closed so far.
Okay.
And we heard earlier today that things are kind of quiet.
Yes.
Which, knock on wood, we hadn't jinxed things. But I'll tell you, I've been in Workday.
Yes.
Have you been in?
I have been looking to sign off on some things,
Yeah,
yes.
and so I signed off on a bunch of stuff earlier this afternoon before coming down here.
Yeah.
And I have to tell you, it's a great system.
Right.
It's easy to use, pretty intuitive. It's good.
So thank you to everybody who rolled that out. We'll continue to update on that.
Big lift going from paper to the computer.
For sure. All right, Fred. Fred, why am I wearing goggles? Why are you wearing a face shield?
Dennis, it's very important that we protect ourselves as providers. So people taking care of patients on the wards really need to not only wear masks, but they need to wear eye protection. Your mucous membranes actually can be an entry point for the virus.
You talked about this earlier in the week and how there had been an outbreak of healthcare workers at a very good hospital in Massachusetts. And one of the things they found is that while people may be wearing masks, they weren't wearing goggles as often as they should.
That's right.
So we're not saying if you're going into Choices Cafe or if you're in the main hallway you wear goggles, but we are saying if you're taking care of patients, this is part of your PPE.
It absolutely is. It's very important.
Okay.
Emphasize all of the important things we need to do. Social distancing, wash your hands, protect yourself with masks and goggles.
Very good. All right, so we're wearing these as a reminder to our workforce to stay safe. That'll do it, I think.
That'll do it.
Okay, we'll be back again on Tuesday. We once again ask that you please take care of yourself, take care of each other, and we'll see you next week.